Thank you for inviting me. As that kind introduction, I work at Royal Papworth Hospital in Cambridge in the UK, and I've been asked to speak about renewing the essence of caring and caring for ourselves, and particularly in time of a pandemic. I'll start with some definitions. So care, the process of protecting someone or something and providing what that person or thing needs. And essence is the basic or most important idea or quality of something. These have come from the Cambridge Dictionary, as I thought that was pertinent from where we are today. I'm focusing on the essence of care in the broadest sense, especially, although that's especially relevant in the pandemic times, I feel it's essential all the time. I have included references and links to resources at the end of the slide pack, which will be shared with you after the session. Thinking about compassion as a starting point, what is the most important quality of caring? What is that essence? And the essence of care is a complex mix of the art and science, and a straightforward definition has eluded scholars and practitioners alike. And so I picked compassion from the starting point of the International Council of Nurses list of 5 core values all nurses must demonstrate: respectfulness, responsiveness, compassion, trustworthiness, and integrity. And I felt compassion is what's particularly pertinent to the session today. So compassion, the Latin root of the word compassion is pati, which means to suffer, and the prefix com means with. So originating from compati, compassion literally means to suffer with. The connection of suffering with another person goes beyond sympathy into the realm of empathy, which is the ability to relate another person's pain as if it's your own. Empathy, like sympathy, is grounded in emotion and feeling, but empathy doesn't have an active component. It's this action, the desire to do something to alleviate suffering, that turns empathy into compassion. Compassion is literally empathy in action. Compassion gets involved. But what happens when we are continuously showing compassion without respite? And what part does our environment play in this? The term burnout is something I'm sure you're familiar with. It was first used in a psychological sense by a German-born American psychologist, Herbert Freudenberger, who used the term to describe symptoms he himself had experienced of exhaustion, disillusionment, and withdrawal resulting from intense devotion to a cause that failed to produce the expected result. Maslach described burnout as a distinct construct that includes a prolonged response to chronic emotional and interpersonal stresses on the job, and is typically identified within the 3 dimensions of exhaustion, cynicism, and a sense of inefficacy. And burnout occurs in organisations typified by high demands and low personal rewards, and it's the increased workload and institutional stress rather than the trauma that particularly serve as precipitating factors. And Maslach found that burnout was a result of mismatches, as shown in this diagram, mismatches of workload, control, reward, community, fairness, and values. And there's considerable interaction amongst these 6 areas, often with values playing a central mediating role that varies within an individual on its particular circumstance. For example, people may well be more willing to accept a workload mismatch if they're compensated well financially. Signs of burnout can show in staff behaviours and things like missing breaks, staying late, coming in on a day off out of a sense of duty. But it's thought that responsibility largely sits with the organisation and depends upon whether a healthy work environment is nurtured. Along with burnout, There's perhaps a less familiar term is vicarious trauma, also known as secondary trauma or secondary traumatic stress. And it's very similar to PTSD, but is experienced by someone caring for or close to the person who experienced the primary trauma. It occurs in people caring for and caring about people who have been traumatized, and this can include critically ill patients. If caregivers focus on what it must be like for themselves or their loved ones to have suffered in this way, they're especially vulnerable to experiencing vicarious trauma. So, for example, imagining that the suffering is happening to themselves, their parent, partner, or child. And it's important to focus on what it must be like for the person suffering. And as professionals, we need to remember that our role is as a partner with the patient, coming alongside them and trying to find ways to help them and focus on what resources they have to overcome trauma or illness. When these two issues, burnout and vicarious trauma, are added together, if they're both in play at the same time, caregivers are at high risk of what's termed compassion fatigue. So what is compassion fatigue? The term compassion fatigue was first coined in the early 90s when a registered nurse, Charla Johnson, described a unique form of burnout that affected caregivers and resulted in a loss of ability to nurture. It was related to a variety of stresses, including long hours, heavy workload, and the need to respond to complex patient needs such as pain, trauma, and emotional distress. So you can see the connection with burnout and vicarious trauma here resulted in nurses feeling tired, depressed, angry, and detached. And it was associated very much with ineffective performance. A key researcher in this field, Charles Figley, described compassion fatigue as a state of exhaustion and dysfunction, biologically, psychologically, socially, as a result of prolonged exposure to compassion stress and all it invokes. Compassion fatigue is not peculiar to healthcare. It's been described in the fields of psychology, social work, aid work, veterinary science, teaching and childcare, and probably many others. But today I'm focusing on the effects in nursing. So there appears to be external or environmental factors and internal personal factors at play here. So what can we do to protect ourselves and protect our teams from compassion fatigue? And what we need to do is nurture eudaimonia. This is considered the highest ethical goal wherein individuals experience long-lasting hope and authentic happiness. This term is derived from Greek philosophy and is often translated simply as happiness, but it's much more than that. Much more than the short-term hedonistic satisfaction. It encompasses growth, self-fulfillment, and purpose. And the concept of eudaimonic well-being is comprised of 6 crucial elements believed to be the prerequisite for authentic, long-lasting happiness. We all really need to nurture eudaimonia by creating the right environment, developing positive relationships, and guiding and supporting each other to be autonomous, self-accepting, and to grow and realize our own purpose in life whilst mastering our environment. All combined, this will ensure that eudaimonic well-being develops and flourishes. So if we look at these individually, creating a healthy work environment can lead to more engaged nurses, decreased burnout, lower staff turnover, and better patient care. And alongside that, developing personal resilience as the relative resistance to environmental risk, which results in individuals overcoming stress and adversity. If we superimpose these two things on one another, it's well documented that there's a reduced likelihood of compassion fatigue. So if we first look at healthy work environment, there are a number of models And although we don't have time to go through these in detail, I'd like to draw your attention to a few key elements. I've highlighted particularly the authentic leadership, and this includes role modelling from the very top of the organisation is a really important part of being able to implement these things. However, it can start with individuals, teams and departments. And the model of relationship-based care, there's a very good example of this from UCLA Health in Los Angeles, which employs a professional governance leadership structure that enables healthcare providers to influence decisions that affect their practice by empowering them to contribute collaboratively as decision makers regarding nursing practice and environment. And this model encompasses this nurturing, trusting, collaborative relationships with the self in the first instance, but with colleagues, patients and families. Another important element of the healthy work environment is being able to assess people's professional quality of life. And the ProQual questionnaire is free to administer and is easy to self-administer or to use in teams. And this can help individuals and teams find what their baseline is and consider what they can do to improve their professional quality of life. And I've highlighted a couple of different standards that are available, although there are many more. The American Association of Critical Care Nurses has a very comprehensive pack of standards that can be used to build healthy working environments. And also the Royal College of Nursing in the UK has developed a healthy workplace toolkit, which is a very practical example of being able to assess where we are as a workplace and come up with practical ideas to improve things. And creating opportunities for collaboration, celebration and sharing both in and out of work are really important for creating a healthy environment. So if we move on now to the self-care at different stages that individuals can consider. This 4-quadrant method, the quadrants of self-care, if you were to ask people what self-care things they employ, many people would list the things that are shown in the blue shaded quadrant, but sometimes are more likely to ignore the things that are in the other 3 quadrants. So this framework was initially developed by Marilyn Krugel, a therapist in the US who worked with professionals like forensic interviewers and law enforcement officers who were routinely exposed to trauma, secondary trauma, as part of their work. And this particular example has been adapted by Jennifer Middleton, who's a professor of social work. And looking at the individual quadrants, I'll just highlight 1 or 2 aspects of this, but there's a more detailed link in the resources to this work. Some key things that people can employ are setting professional boundaries to prevent emotional over-involvement, reminding yourself that you're viewing the patient's suffering from their perspective and not yours or your family's. Using transition rituals are very helpful, both at the beginning and the end of the day. And these can be as simple as putting on your uniform or your badge, or literally and virtually unpacking your day from your locker or your bag and putting it back into there at the end of the day. And also using check-in with yourself and perhaps with others at the start of the shift in order to ground yourself and focus on the task in hand, and asking yourself questions such as, how am I feeling today? What's my goal for today or for this interaction? And who can help me with this? It's known that the outcomes of this deliberate and repetitive transition ritual are increased awareness of feelings, improved ability to focus on the future, rather than dwelling on the past, and develop a stronger sense of community and support. If you feel unhelpful feelings building, to take a step back and actually position your hands with your palms facing outwards slightly is a very powerful action to create a bit of space and give yourself a moment to ensure that you're not getting so emotionally involved, and this can protect you. Actually, during an interaction, focusing on your role in caring and the task at hand and repeating this as a positive mantra can be really helpful. Indeed, the separation thing that I just described of stepping back with your palms out facing can help during an interaction as well. And particularly noticing your reactions, acknowledging your feelings at the time and saying goodbye to them or noting them for later reflection can remove those unhelpful feelings during an interaction. And then right after an interaction or your day, using those transition rituals again at the end of the day, maybe visualizing somebody else helping your patient, and body awareness and breathing and movement exercises. Reflection has also been shown to be really helpful, and taking out the things that you perhaps noted earlier in the day and reflecting on those, maybe talking them through with a colleague or friend. Recall the positive differences that you've made during the day and explore the feelings that these bring up. Another very helpful technique is to write down 3 things that you've been grateful for during the day, perhaps in a diary or in a piece of paper that you put in a jar so that you can look back on another time. Now thinking about the wider personal resilience, this has been adapted from some work by the American Psychological Society. Some people think that you either have resilience or you don't, that it's in some way an inherent trait, but in fact resilience is something that can be taught, learned and practiced, and resilience involves behaviours, thoughts and actions that anyone can learn and develop. This list is adapted from the American Psychological Society, but there are many other ones, and again there's a link to this later in the pack. In the interest of time, I'd like to pick out just 3 from this list that I feel are absolutely key. And the first of these is prioritizing relationships, finding and connecting with trustworthy, compassionate individual who you can talk with in an open and validating manner, both in and out of work. And embracing active hope based on the work by Johanna Macy, who developed a groundbreaking theoretical framework for personal and social change, as well as a powerful workshop methodology for its application called The Work That Reconnects. This active hope allows an individual to turn their hope for the future into action, which in itself allows you to feel that you're playing a part in helping you to get to your goals. And then lastly, practicing mindfulness, trying to come off autopilot and develop the basic human ability to be fully present, to be aware of where we are and what we're doing, and not overly reactive or overwhelmed by what's going on around us. One way to do this is to spend time outside connecting with nature, to take time to notice and explore the leaves, flowers, clouds and creatures around you, and immerse yourself in the wonder of the detail and the ever-changing world really close up. Taking time to touch, smell and listen, as well as look and allow what you experience to soak right into your very being. And what I'd like to spend the last short while is to take you on a journey of a mindfulness activity that you can do almost anywhere, anytime. So if you're comfortable and you're happy to do so, I'd like you to position yourself in a comfortable seated position with your feet on the floor. If you'd like to do so, please do close your eyes. I'd like you to bring to mind a beautiful place that you've spent your time in, a place that you feel joyful and comfortable in. And bring to mind what you can see in that beautiful place. Bringing to mind the detail of the things that you can see around you. They might be moving, they might be still, but bring to mind the beauty that you can see. Try to focus on what you can hear. What are the sounds happening in this beautiful place that you've taken yourself to? Do the sounds remind you and connect you to that place? The beautiful sounds that you can detect in your beautiful place. And then focus on what this place smells like. The beautiful place that you're in. Can you smell the place that you're in? And if you were to reach out and touch the things that are around you in this beautiful place, what would you feel? Taking a slow, gentle breath in through your nose and taking in the beauty that's surrounding you in the place that's in your mind. And just absorbing that beauty for a moment. Bringing the beauty of this place with you back to the room, back to the conference, and all the feelings that come with that beautiful place. Back with you for the rest of your day. If you open your eyes, bringing all that beauty back with you. I'm sure you've all had all different places that you've taken yourself to. And I'd just like to share with you the beautiful place that I go to when I do that exercise. It's the most delightful beech forest in the UK near where I grew up. And this is the place that I go to when I do that exercise. I hope you've enjoyed this session, and I thank you very much for your time.